This week we're going over healthcare disparities, and this is your concept number 54, and it begins on page 504 in your textbook. When we're looking here at healthcare disparities, there are different definitions that you're going to find. So I want you to make sure that you understand the concept and look at some of the ways that we identify healthcare disparities, especially those as nurses, and then how we use this and apply this concept in our care for our patients and within our communities. We also want to make sure that we understand how the exemplars are also involved in this concept. So let's take a quick look at the definition. You'll see that in your NCO book there are different definitions by different organizations that have a little bit different definition, but there's still a main theme within. So we're going to talk about a couple of those. This textbook actually used this definition as the differences in the quality of care received by minorities and non-minorities. And it's those, everyone should have equal access to care, and that is when these groups have similar health insurance and the same access to a doctor. And when there are no differences between these groups in their preferences and the needs in treatment. When we look at Healthy People 2020, they actually have a definition that is defined as the differences that occur in gender, race, ethnicity, education or income, disability, living in rural localities, or sexual orientation. If you look at Health Resources and Services Administrations, they give a definition of population-specific differences in the presence of disease, health outcomes, and access to care. So what's common in these differences is the health status between one or more population groups compared to a more advantaged group. And so we also need to keep in mind social justice and equality as specific components when we're looking at healthcare disparities. Some of your definitions are more towards race and ethnicities, but there's a lot more to it than just that. So I want you to keep an open mind, especially when we look at communities and looking at the needs of the community, and that is going into healthcare disparities and how can we help to eliminate those. Here's some special terms that I do want to make sure that you do look at in your textbook. And so this is looking at your unavoidable disparities, your avoidable disparities, stereotyping, and prejudice. And we'll talk a little bit more about that here in a few minutes, and because I do want you to look at these disparities, and when we look at avoidable and unavoidable, they have a nice little diagram, and it's also up on your Blackboard site, and it looks at acceptable and unacceptable avoidable disparities, or acceptable and unacceptable unavoidable disparities. And so your textbook does a nice job of giving examples and details about that, and that's on page 506 when we come to that. And here's an example of that graph I was telling you about. So here are 7 determinants that were identified, and these are looking at differences in environmental access to and utilization of and quality of care, health statuses, and your different particular health outcomes that we're looking at. So they looked at 7 determinants for health disparities. So when we're looking at this, we see natural and biological variations. We're looking at health damaging behavior that is freely chosen, such as eating habits, exercise, someone making the conscious decision not to take the medication, or someone using poor coping measures for reducing stress. We also see advantages of one group over another when one group is first to adopt a health promotion behavior, and so that can also make a difference within a community. A certain area of a community might have more let me say, options to have health care. And also we see damaging behavior and that people choose as a lifestyle. And we also see exposure of unhealthy, stressful living and working conditions. We'll talk a little bit more about that here shortly. Inadequate access to health services and other basic services, especially those who live way out in rural areas and don't have transportation. We also have natural selection or health-related social mobility involving sick people who seem to move down the social scale. In other words, they're sick or maybe have a psychiatric issue, they're unable to work, they start to lose their income, maybe lose a home, maybe end up being homeless, don't have insurance, to have no way to help themselves. So these are some different determinants that we look at. Here's an example of Canada's attributes that they look at towards health, and these are some of the determinants that they look at for healthcare disparities and how they can overcome and help the population to overcome these disparities so that they are able to get better health care and have better health outcomes. Just want you to know I'm going to be, you'll see some of the activities that we're going to be doing in class. So this is going to be one of those if you want to kind of get your thinking cap on. I ask that you not do this before class, but you at least look at it and start having some thoughts. Now we're going to kind of get into some of the thinking and ideas that we can use to help to link healthcare to some of these healthcare disparities. This is a model that some individuals can use, and this is looking at some of the elements, especially with dealing with cultural issues and working with the community and healthcare disparities. So you have your interpersonal interactions and your organizations that can assist with that. One of the organizations that we see is actually interpreters helping with language assistance for those who have limited or no English language capabilities. Some of the interpersonal things that we do is making sure that we find a common ground as far as health and healthcare beliefs, and that we establish some trust, build a good relationship, be very knowledgeable about the different cultures that you're going to be in contact in your community, whether you're working as a community or public healthcare nurse, you're working in acute care, or you're working as outpatient care. So any of those types of facilities that you would work with, you want to look at these interactions, and so pay close attention to the bullets, review those, and also the organizations. So now let's think about how we want to apply the concept in our nursing care within our scope of practice. Some of the things that we want to think about is things that are going to be avoidable, and then those unacceptable disparities that we see a lot. So some of those can be the lack of health insurance and high health care cost. Some individuals did try to get health care, but once they got the health care, the cost of the care and the premiums and their copays were so high that it was not even worth them having. So we need to find some way that we can let individuals have health care and access to that health care, but that is also affordable. We tried the affordable health care act. However, what was happening is that even though they could afford the health care, the premiums and the copays were so high that no one could use those. It was also based on income, so the amounts would change depending on their job and their income status that they had at the time. Also, too, another one is language barriers. So we're looking at this. There should, we at least should have interpreters so we can, because that is not a good excuse just because you can't understand what they're saying. They can't understand what you're saying. We need to find ways, and we're doing really, really well with this one, but we still need more access to ways to access needs for this situation. Lack of transportation is another one. Some of your cities do have transportation, but some of your way out rural areas, those individuals still are not getting that need met. So we want to look at transportation. What do we have in our communities? So when we're thinking about taking care of our patients and them being able to have access, and there's lack of transportation, maybe we need to go to them. You have some communities that actually have a healthcare bus that they use, and they go out into these rural areas to take care of patients and do diagnostics and healthcare health wellness checkups on these individuals. So if you're looking at where can we establish an urgent care and how can individuals get here, those are some things that you want to think about. Do they have transportation? Do they have, taxis or cabs, or do they have a community bus for these individuals to get to their healthcare provider? Provider-patient communication. Sometimes there's a disconnect between the healthcare provider and that patient, and sometimes communication can be a language barrier, or it could be a lack of understanding or not taking the time to understand. We live in a fast-paced world, and if you notice when you go into a doctor's office, that healthcare provider is not there with you very long. So can you imagine what it would be like for a patient from a different culture or ethnicities, different social group that have different difficulties in being able to communicate with that health care provider, and that provider not spending time with them. A lot of things can be lost. Biased clinical decision making. Unfortunately, we do have that, and sometimes doctors and healthcare providers in general sometimes don't have patience to sit there and work with their patients, and they become very biased about a certain group of patients. Don't mean to pick on those who are drug abusers, but maybe they just see them, they're just seeking drugs, and they have this biased opinion, and they really don't look at the needs of that patient. Maybe they really are in pain. And so how can we help them instead of having that bias? And mistrust and refusal. Some patients just don't trust. Some cultures don't trust healthcare. Some cultures don't even trust free healthcare. They feel like there's something to it. And so they're very wary and may not get the help that they need. Or they just may refuse it due to their cultural health beliefs. Here's the second activity that we are going to do in class. So again, make sure you understand the definitions, and we're going to discuss and do some class activities here. Your textbook gives some interrelated concepts. The exemplars that we're going to be using are going to be different, but again, with healthcare disparities, communication and culture are very, very big in here, and health promotion. So we're going to look at those, but we're actually going to have some different exemplars that we're going to discuss in class. So if you look at these concepts that we use around healthcare disparities, you'll actually see that there's a commonality here: health promotion, health policies, and quality of care. We're going to look at communication, health law, healthcare law that is, and cultures. So these all are interrelated, and when we listen to your other PowerPoint that go along with your textbook, we'll also be mentioning the vulnerable populations and how this all interrelates together. And if we have time, we'll also be working on this learning activity.